Our mission is to improve the health and wellness of our patients and the communities we serve by providing the highest quality products, services, and advice to meet their unique healthcare needs. We're excited to be one of the first groups of healthcare providers in the state of Pennsylvania to be able to help Pennsylvanians who have long suffered from serious medical conditions without getting adequate relief.
We have this amazing state-of-the-art production facility here, and we know that we can definitely grow pharmaceutical-grade medical marijuana in a production facility like this consistently and at a great value to the Pennsylvania citizen. A facility like this is ideal for any type of plant growth and plant health. A facility like this would be ideal for medical marijuana, and the fact that we would be able to grow it here efficiently, grow it here at lower cost, grow it here with lower inputs, and allow us to put out a cleaner medical cannabis. That can't be done growing inside where you have to use a lot of heating and cooling by HVAC. We use ours through a natural process of sunlight and ventilation.
The Organic Remedies leadership team is led by healthcare professionals. There are 6 pharmacists, including myself, on the team. Together, we have over 100 years of pharmacy practice experience.
Several members of our team, including myself, are knowledgeable of supercritical fluid extractions and are able to take these plants and extract the constituents that will then be used to formulate products that can be used to vaporize, to nebulize, also for pills and tablets and capsules, and also in tinctures and dermal preparations.
I'm here as director of the Community Advisory Council for Organic Remedies, and to be able to provide information, feedback from the community, be good stewards in the communities that we'll be serving, and bring together professionals and community members to advise Organic Remedies.
Our pharmacists and healthcare providers will be highly educated in medicinal cannabinoids and therapeutic treatment options.
All the way from growing the plant, formulating the products, dispensing the products, following the patients, and all of that feeding back into the product. And I think the team that has been put together to facilitate that and to ensure things like quality assurance and the quality controls that are necessary to make that successful.
We're going to have more and more information to bring to the medical community, say these things work. And to me, that's exciting. And education is the #1 piece. So we'll be going out into the community to educate physicians, behavioral health specialists, the general population.
We are dedicated to unlocking the therapeutic benefits of medicinal cannabinoids through research. We will utilize a one-of-a-kind, state-of-the-art data collection tool developed by a Pennsylvania physician named Dr. Sidney Goldblatt.
The Clinical Semantic Network includes in its body of medical knowledge as data the contents of the DSM-5, that's the Diagnostic and Statistical Manual for Psychiatry. In that book are all of the criteria for the more than 300 recognized disorders treated by psychiatrists. And one of them is cannabinoid use disorder. We would ask the questions as cataloged in that document that not only describe drug-seeking behavior, but also withdrawal behavior, which would signal the misuse of cannabis. We would develop a questionnaire that the patient would take, perhaps on a daily basis, describing their pain. We would try to correlate that with the changes both in cannabinoid form that we were given to the patient, as well as in the dose used. In the laboratory, we would measure the purity of cannabinoid and its exact amount using our mass spectrometric technologies. Also in the laboratory, where we are able to do genomic studies on the genomics of the enzymes that metabolize chemicals, including the cannabinoids. We would look to see if the individuals inherited differences in those metabolic enzymes. In this way, we would describe a clinical trial to examine the behavior of patients who use these cannabinoid treatments.
We've been working with the Duquesne University School of Pharmacy to develop clinical research that will follow patients that are taking medical marijuana, and also formulating types of programs that can be used that would specifically look at a disorder and the dosages and how the marijuana is being used by those patients that then would provide benefit in therapy.
There's so much not understood about the plant and the plant-based therapy yet that it's going to take years to unlock the full potential of the plant, and it's going to require an in-depth research process to do so.
By having medicinal cannabinoids available, we could certainly mitigate the risk of addiction to opioids and, in general, minimize the amount of opioids that are available both through the pharmacy as well as the illicit channels that exist in our society.
The opioid epidemic as it stands in America is the worst I've seen in my 43 years. The problem is we have, since 1999, quadrupled the number of prescription opioids written to patients.
The United States represents 5% of the global population, yet utilizes 80 to 90% of all of the opioids in the world. That's just a staggering number when you think about how accessible that drug is.
Fentanyl and analogs of fentanyl have made their way into illicit distribution, and people taking these drugs not only for recreational use, but also seeking these drugs out after becoming addicted to opioid drugs and then not being able to continue that addiction through bona fide medical use.
We're very much involved in the opioid epidemic. At Forensic DX, we do forensic autopsies, coroner's autopsies, for 10 counties here in Pennsylvania. And opioid deaths is now the most common single cause of death that we see. It is nearly a daily occurrence. Unfortunately, we refer to these in law as accidental death, and drug overdose is the most common form of accidental death. We could debate that. We at Molecular DX and at Goldblatt Systems really think of it as wrongful death, even deliberate death, because we think that those chemicals are well known to be poisonous. And it's the management of pain using opioids that is the foundation of the opioid epidemic. Indeed, many people are introduced to opioids after a painful medical procedure or a painful disorder for which some opioid is prescribed. If cannabinoids can be useful in managing pain, they can become a silver bullet in dealing with this horrible scourge, the opioid epidemic.
Opioid addiction and opioid abuse isn't a choice, it's a disease. And medical marijuana provides a great alternative line of defense against treating chronic pain.
It would be immoral and unethical of us to know that the benefits of something like medicinal cannabinoids could indeed provide some positive effect in that effort. I think it would be something that we as a community and society would absolutely have to do.
Chronic pain is one of those things that traditionally doctors have prescribed opioids for, which leads to addiction, which leads to death. So if we can get doctors to start thinking this way, use this, put this in your beautiful leather doctor bag as something that can be used to treat chronic pain, we're going to cut way back on deaths from opioid abuse.
If we can take medical marijuana and help people move off of an opioid by using one of the derivatives of medicinal marijuana to get off opioids, that's a success.
I went to pharmacy school to help people. And one of the biggest needs that I see across the state and across the nation involves finding better therapies, less addictive therapies, safer therapies for our patients. Medicinal cannabinoids represent all of those things.
I really feel so horrible for those families who are having, have a child with epilepsy or having to go to other states to try to get it. A lot of those families brought their sick kids into my office so I could see. And it's so sad, it's so heart-wrenching. And we have the capability to help them, and I think it's important that we move fast.
We need to think differently. I'm excited by that possibility of being able to take somebody off something that will eventually kill them and give them something that helps their pain, manage their day-to-day life, and gives them quality of life for the long term.